The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD warriors. We are here for the next episode of TMD Demystified, and I am Tony Urbanek. Today's topic, I gain no extra pleasure in discussing this, as you will note as we go through it. The title of today is a continuation of our fact-checking regarding certain aspects of TMD, TMJ. The title is Fact-Checking TMD and OSA. We can even call it Fact-Checking Revisited, because a previous episode I did, and I just looked it up, episode number 172, which I'll make reference to in a little bit, was on the same topic. But today, Fact-Checking TMD and OSA Part 7, Discovery of Why TMD Gurus, we can define TMD Gurus for you, promote the relationship between OSA and TMD, and whether or not this is factually correct. Spoiler alert, it is not factually correct. It is not factually correct, and I'm going to discuss that. And it's not my opinion. It is fact, although there are growing numbers of what I refer to, and I will defend it, TMD gurus who use smoke and mirrors and nonsense and throw things at the wall to see if they can stick and defend their positions, primarily using unsupported, quote, unscientific studies and word salad descriptions. Those are pretty strong terms, but I'm going to describe it for you, defend it, and invite anyone who wants to dispute, criticize, or just discuss in a friendly manner this issue. So again, the title for today is Fact-Checking TMD and OSA, Part 7, The Discovery of Why TMD Gurus Promote the Relationship Between OSA and TMD. Frankly, there is no relationship. There is an association. But as you will find out, an old adage in medicine, that association does not prove causation. Let me repeat that. That is a very old adage all throughout medicine. Association does not prove causation. And that is what the OSA TMD gurus have been trying to do for quite some time. And this weekend, I found out why. I'm a little naive on some of these topics because I'm a scientist. I look at things very logically and primarily based on what I have observed personally in treating over, both surgically and non-surgically, well over 6,000 patients, roughly about, right now, about 5,000 non-surgically. And so we have to increase that to about 7,000, because I treated roughly 2,000 patients surgically over the first 36 years of my career, and did every kind of TMJ surgery available at that time and currently, because there has not been any significant improvement in TMJ surgery since I quit doing TMJ surgery 14 years ago. So number one, I am quite experienced in both surgical and non-surgical care of the TMJ patients. Not to brag, I don't need it. But here is what happened, and here is how I found out why there has been this major push by the TMD, quote, specialists. Now we have been encumbered by the ADA to call orofacial pain doctors specialists. And it is my contention that that was a very dumb move by the ADA, and that we definitely don't need orofacial pain specialists, because the vast majority, I can't quote what percentage, I'm not going to do a study on it myself, but I can tell you that the vast majority of patients with orofacial pain that is unrelated to, quote, easily identifiable dental problems or easily identifiable ENT problems, easily identified ENT problems, are related to the temporomandibular joint. And I have spoken on this on previous episodes, all the way back to the beginning. And today's episode is episode 190 on this episode series on TMD Demystified, which is published on Dental Town. So this is what I found out this weekend as to why there's been this push, and I couldn't quite figure it out, because episode number 172, I discussed the nuts and bolts, what I had discovered about the relationship or lack thereof of TMD to OSA, which was stimulated by a email I received from one of my colleagues who was trying to convince me that there is a relationship. So I had to take a deep dive into the literature, into the books, and see whether or not what my experience was and what my knowledge of was consistent with what other academicians have found about this relationship. And that was, so 72 to 90, we're talking 18 episodes. So that's roughly 4.5 months ago I did that. I'll let that stand alone and speak for itself. But here's what I found out this weekend. This weekend, I had the opportunity to speak on my topic, TMD Demystified, to one of the largest dental meetings in the United States of America, the Chicago Dental Society Midwinter Meeting, which was just last weekend, and I was invited to speak on my topic. Fortunately, it was extremely successful. Out of the 100 or so programs that was offered at the Chicago Midwinter Meeting, mine was one of just a very few. As I looked at it, only 3 or 4 of the programs that actually sold out. We filled a room with over 200 people. There were people waiting in the hallway to get in if there were seats available, with no shows. And I presented TMD Demystified, which again is described well throughout these 190 episodes on Dental Town, TMD Demystified. But after I presented, I had the opportunity to meet one of my colleagues at a social gathering and found out what I do, and she shared with me the following story. And it's pretty simple, and it's similar to many stories I heard before. First of all, she heard my lecture, wanted to talk with me, and said her sister, we will call the person I was talking to Mary, and Mary had a sister who had severe temporomandibular joint disorder and had had this problem and multiple symptoms for 20 years, and that the symptoms themselves were ruining her life and had literally devastated her to the point where she was, for the most part, non-functional as far as ability to work or enjoy her life. And she shared with me parts of the story at how many doctors she had seen. She had spent time down in Florida. She had seen people in South Carolina. She had seen people, practitioners in Missouri, and had gone to some of the bigger name clinics that you would easily recognize in the United States of America regarding her symptoms, looking for a solution, which she did not have. So Mary's sister, as Mary described, was eventually referred to what I will call a TMD guru in St. Louis, Missouri, who claimed that he was able to fix TMD patients with appropriate solutions. So she, again, the story was that she went to this doctor and he did a thorough workup, consultation, examination, and after he was finished, told Mary's sister that the reason that none of the other doctors were able to help her was that they did not recognize that Mary's problem was generated by her OSA, obstructive sleep apnea, that there was a relationship between OSA and which was causal for her TMD. And as soon as he received approval from the medical insurance companies to treat her OSA, that he would do that, which would have significant influence on the TMD, and then he could get on with treating the TMD, that there was a definite causal relationship. When I heard that, all the pieces fit together, and I went, oh my God, that is the reason that there has been such a big push for the past 10 years or more to try to prove through inappropriate science that there is a causal relationship between OSA and TMD and vice versa. The TMD has a causal relationship with OSA. The one that I heard recently about that, the causal relationship of TMD, which kind of went like this. It's like there are more people with narrow maxillas with TMD, and narrow maxilla enhances OSA. Now, as a oral and maxillofacial surgeon, extensively trained in maxillomandibular advancement and orthognathic surgery, I can share with you lots of experience in moving the maxilla and mandible forward to increase the airway, posterior airway. Maxillomandibular advancement is a pretty big operation where you literally cut the maxilla and mandible free, orthognathically plate, then screw them back together, and it pulls not only the lower face, but along with it, the tongue, and increases the airway behind the tongue to the point where when the patient goes to sleep and the muscles relax, they relax, but there's adequate airway there so that now air can move up and down, versus when they have a class 2 position or a retrognathic mandible, there is narrow airway, and when they go to sleep, it closes off, creating obstructive sleep apnea. So maxillomandibular advancement actually pulls the entire lower face forward, including the tongue, including the mandible, increasing the posterior airway behind the tongue. And in my hands, in my experience, over a period of roughly 40 some years, it was 100% successful when that operation is performed. I don't recommend it for everyone. In fact, I only used it and only recommended be used it when no other solutions were available and the patient was so distraught and so problematic about the problem that they consented to the operation. which was fine. It was good operation. It really wasn't as bad as it sounds. You are quite swollen afterwards. However, it fixed the problem 100% of the time. All right, so what I learned, oh my God, was that trying to game the medical industry, the medical insurance companies, to pay for TMD treatment, which is not paid for routinely at all by medical insurance. Non-surgical TMD treatment is not paid for by medical insurance. And I have many stories to tell about that and my conflicts over several years with Blue Cross Blue Shield, who finally said, we are not going to cover non-surgical TMD, and there is no CPT code, and we're not going to apply for CPT code. However, surgical treatment of the temporomandibular joint, if it had coverage, is always going to be covered, was always covered by medical insurance, not dental insurance. So to repeat something I've repeated many times on these episodes, if it is covered medically, surgically, it makes no sense why it shouldn't be covered non-surgically if you have the solution to the TMD conundrum. But currently, that's just the way it is, and it was proven to me that it's not going to be covered by Blue Cross Blue Shield of Tennessee and many other insurance companies. But not to go into the weeds talking about insurance, the topic today is why and how I found out and finally overcame my naivety as to really why there has been this big push to connect the relationship and the causal relationship between OSA and TMD. And it is simply that the TMD gurus saw an opportunity to get TMD covered via medical insurance by claiming there is a causal relationship to OSA, obstructive sleep apnea, which is frequently covered by medical insurance, as are the oral devices for obstructive sleep apnea, and actually getting more common. For those of you who are not familiar, let me just remind you that obstructive sleep apnea has primarily been treated with CPAP, facial mask, literally forcing air through the posterior pharynx into the lungs, and has been very successful. Literally, if it's used, it's successful 100% of the time. The problem is only 20% of patients will use the CPAP mask, want to use the CPAP mask. So it has been prescribed by pulmonologists and PCPs significantly 100% of the time, but only used effectively by 20% of the patients. And that is why oral devices, which have a success rate in the 80s, I quote 85% to patients, 85% successful, not as successful as CPAP, but it is successful in 85% of the time, which creates a better solution for the patient because their ability to use oral devices is much higher. In fact, I have seen using oral devices for OSA, the compliance rate is almost 100%. Very, very rarely have I run across a patient who cannot tolerate an oral device for obstructive sleep apnea. I frankly don't remember the last time I had someone says, I can't tolerate this. So it is very disappointing for me to find out that my colleagues are gaming the system and gaming the insurance companies and trying to make this relationship stick. Let me quote. So to prove my point, I pulled out the most authoritative textbook on sleep medicine, The Principles and Practice of Sleep Medicine, which is the most authoritative and available textbook on all aspects of sleep medicine. And there are several chapters on the relationship or lack thereof of obstructive sleep apnea and bruxism or temporomandibular joint disease. And so I'll just quote a chapter highlight. The chapter is chapter 146, page 1435. This is a very extensive textbook. It weighs about probably 15 pounds, 20 pounds. I will quote this chapter highlight, which is a highlight describing the contents of this entire chapter. But I'll read it to you verbatim. The premise that sleep disorder breathing, which is sleep apnea, leads to sleep bruxism, and therefore TMD, and to carry on, and in turn, TMD is not supported by the available scientific evidence. Moreover, the strongest evidence refutes a relationship between sleep bruxism and TMD. That patients with signs and symptoms of TMD often report grinding their teeth during sleep has been misrepresented by clinicians as evidence of an association. So, and the primary author of this chapter is Dr. K. Essex. Dr. K. Essex. So for those of you who want to pursue this concept that you want to prove or use the association, causal association of TMD and OSA, you are not correct. You're incorrect. And I take question about your motives rather than being motivated by actually helping patients. You're motivated more by the remunerative ability to gain insurance coverage for TMD by associating it with OSA. And I will stand by that. All right. Well, I didn't take any great pleasure in describing this particular presentation, part of the presentation. But as my title of the podcast goes, it is about TMD Demystified. And consistent with the title, I have demystified in this case, the TMD guru's attempts to make OSA and TMD causal relationship. With that being said, I look forward to any comments, criticisms from you, the viewers. I can be reached at Tony at tmjservices.net. Those of you who would like to learn how to properly and successfully treat TMD non-surgically using a very simple device and protocol, you can learn more about it at www.urbanektmj.com. And if you would like to take one of our seminars, we have quarterly seminars available in Nashville and an online course regarding becoming a network provider using the Urbanek Device and protocol. With that said, I look forward to the viewer meeting us next week, always on a Tuesday morning for me, at this spot on Dental Town, TMD Demystified. I look forward to seeing you again.